Prof, you are welcome to What is Next.
Thank you very much.
And we are happy you've made the time.
Thank you.
Yes, we know you to be Professor Charles Ansah, a former Pro-Vice-Chancellor, but help us to know a little bit about you. Who is Reverend Professor Charles Ansah?
A little bit, you said?
Yes.
Okay. Reverend, thank you very much. Tonight I wear 3 caps. And the first cap that I wear is I'm a pharmacist by profession. Apart from that, I'm a university professor and a researcher. And again, last but not the least, a minister of the Gospel of Christ. I attended Koforia Secondary Technical School, so I am Barumaba. And I did 1 to 5 as well as the 6th form there. The same year, I qualified to read pharmacy at Kwabena Opuni-Frimpong University of Science and Technology. When I completed pharmacy, I was selected to do my national service in the Faculty of Pharmacy and Pharmaceutical Sciences. In those days, national service, you had to do it for 2 years. So I did it for 2 years, and then I was appointed as a demonstrator and teaching assistant, supporting research for the professors, and also doing some teaching as well. A couple of years later, I got a British Council scholarship to study for my master's degree at the then Royal Postgraduate Medical School, Imperial College, London. It was about 18 months. I finished, came back, and I was appointed a lecturer. At that time, we had only the medical school and then the pharmacy school. So I was teaching pharmacology and toxicology in these schools, and supported the senior members also in their research. 5 years later, I was lucky. I got a prestigious Commonwealth scholarship to study for my PhD in toxicology at Imperial College, London. I returned after the program to Kwabena Opuni-Frimpong University of Science and Technology, where I've served as a lecturer for many years. What we do mainly is research and teaching. So I teach undergraduate students, I teach postgraduate students, I do research, and my area of research is safety of medications. Especially, we are interested in the safety of herbal medications, and that is where my area is, as well as looking at the efficacy also of the herbal medications. I've served the university extensively, let me say, serving on various committees, and before I was appointed Pro-Vice-Chancellor, I've been head of department a couple of times, and the dean of the Faculty of Pharmacy and Pharmaceutical Sciences. On the national front, I've served as a member of the Pharmacy Council. I've also served as a member of the Clinical Trial Committee of the Food and Drug Board for almost 10 years. I've also served on the Mampong Scientific Research into Plant Medicine. I was a member of their board for a number of times. Above all, that's not all I do. I am a minister of the Gospel of Christ, and I take keen interest in the youth, supporting them in their career development, etc. So basically, that is what I do. Presently, my teaching is mainly postgraduate. Do I do some undergraduate teaching, especially the first years, who need a foundation to be able to build upon that. So I teach first year and then postgraduate, and I supervise as well, and then mentor students. Basically, that's my life. And that's what I do.
So, a university administrator, professor of pharmacology, and a pastor, minister of the gospel. Are there some values that have kept you over the years in your academic, professional ministry, values that you will not let go?
Oh, Reverend, certainly. I grew up doing things for myself, sweeping, washing, ironing, doing everything for myself. So sometimes people don't. If I'm holding a bag in the church, for instance, church premises, and people want to, and I say, "Oh, it's okay," they don't understand. But I prefer doing things for myself. So hard work, I was taught from the beginning to work hard. So that's one of my values. Apart from that, I don't give up. You have to persevere in whatever you are doing. Failures may come, challenges may come, but you still have to push. And one of the things that, even as I sit here, I want to advise the youth, is the fact that you can change your destiny by studying hard. I know where I came from, and I know where I am now, and I can ascribe that to the hard work of studies, the studies that I did. Having said that, determination is also very important, and as a human being, you can never be right all the time. people will offend you, you try and forgive, and then again you look forward. So basically, that is that. And I think that when it comes to perseverance, determination, and hard work, they are my key values, and I make sure that I don't compromise on them at all.
I know that some of your students or colleagues in the pharmacy or church members may want to see you as their mentor, somebody who they will want to show gratitude. But do you also have people who have made impact on your life, your academic, on your ministry, people that on our platform, What is Next, you will want to affirm, just to say thank you to? One or two people that on our program you will want to express your
Reverend, the list is endless, and I would wish that this would have been the main topic for the program. But for lack of time, let me mention a few. And I want to pay tribute to my daddy Jacob. Jacob never went to school. He took it upon himself, the meager resources that he had, to educate us. And I think that if he had anywhere, then it is his initiative that brought us this far. May he so rest in peace. Apart from that, my senior brother Samuel, when I completed Middle Form 4, two of my siblings were in secondary school already. And it was difficult for the old man to be able to, take me to secondary school. But my senior brother, was in school already. But he said, "Oh, Daddy, I can be a day student and give opportunity to my brother also to go." So he offloaded his shoes to me. He offloaded his polo shirts, singlet, everything that you need for the bird, bed sheets. And I think that has helped me a lot. It was the initial step that he took that has brought me this far. So I want to thank Samuel. If he's listening to this program, Samuel, I thank you very much. Apart from that, many people that I've met through my schooling have made impact in my life. Master Eboa is somebody who taught me, how do we call it, a middle school from 4. And he was a wonderful man. When it comes to love, he will show it, he will give you encouragement, he will give you support. And I think that is somebody that I want to thank. In the university, we met a man who was the head of department at the time that I completed pharmacy school. And I was a teaching assistant, the late Professor Ansah. Ansah was a wonderful person. When it comes to love and kindness, he was a wonderful man, and he encouraged us. I need to mention Professor A.C. Sakifio as well. Sakifio was also in the department, and all the time, he said to us that don't waste your youth. I was doing my national service with Professor Alex Dodu. Maybe you know him. He's the director of Standards Board at this time. And we were doing together. Young men, you work a little in the lab and then you go sit under the tree. Sakifio will come, don't waste, go back to the lab. And I think that that has encouraged us, that has helped us to reach where we are. And we want to thank them. I have to thank him very much. There are many people that I have to thank. Professor Mahama Duwedra, Professor Wood. They were my seniors when I started as a lecturer, and we look forward to them. Many of the lecturers in the Faculty of Pharmacy and Pharmaceutical Sciences that I can't mention, but they played an active role in my life. I cannot finish this part without mentioning my wife, a wonderful person. Gertrude is, she's loyal, she's committed, she's selfless. And I think that I've learned a lot from her, and I want to thank her very much for that. Reverend, there are many, many people that we need to thank. Sometimes you travel, you are on air. Somebody who sits by you may see one or two things that will influence your life. And I think that there are many people. You have influenced my life as well, and you have supported in many ways. So thank you very much.
Great. Yes. Viewers, this is What is Next, and I'm in conversation with Reverend Professor Charles Ansah. We are reflecting on the subject, abuse and misuse of medication. Now, Prof, is medication abuse and misuse an issue of concern in Ghana?
I think so, Reverend. I think so. And it's extensive. I don't think we have the data to support what I'm going to say now, because we haven't done research much over the years in the area of who is misusing drugs and who is not misusing, so that, like, we are in a position to say that 20% of the population are misusing drugs. We are unable to do that. But I think that what you hear on the media is very important about drugs. Recently, you remember the issue of tramadol that came up strongly. Sometimes also, Reverend, on the highways, armed robbery and things that go on. See the crimes that are committed, and you conclude that this cannot come from an ordinary person, and you may conclude that it's likely that this person was on drugs. And I think that for us as a nation, a lot of people are concerned about it. Parents are concerned, headmasters are concerned, hallmasters are concerned, especially in the universities and our secondary schools. And I think that NGOs are also concerned. And what we need to do is to come together to ensure that we are able to bring this under control. I've talked about hard drugs, but when it comes to misuse of drugs, that is also a problem, a major problem. People abuse painkillers. Now, when it comes to antibiotics, for instance, let me give the example in the United Kingdom. Even as at now, major operations, they may not use antibiotics at all, or if they have to use, they will use very mild antibiotics, let me put it that way, like penicillin. Here, if there's an operation, a major operation, you have to be careful so that you have to use a higher antibiotic. Let me put it that way for my viewers to understand. A higher antibiotic. And most of the antibiotics that we have are gradually losing their potency because of abuse. Aphrodisiacs, these are drugs that enhance sexual performance, they are being abused. And many other drugs that are being abused. So when it comes to drug abuse and misuse, I would say that it's a cause to worry, and we must do something about it.
Yes, but you've mentioned tramadol and others, but is it, what does it mean? Can it be that if I am on prescription by my doctors, my pharmacists, can we also have abuse and misuse on where prescriptions have even been made?
Of course. Let me take the opportunity to explain this. We have used the term misuse and abuse interchangeably, but they are different. When we say you are misusing drugs, then you are not taking the drug according to the prescription that you were directed by either the pharmacist or the nurse or the doctor. So you are using it outside what you were directed to do, right? In other words, the purpose for which you were given the drug is not what you are using the drug for. Or you have ignored the instructions and you are doing your own thing. And that happens with prescription drugs, just as you are saying. And that is a clear issue of misuse. Let me give you a few examples. When you are given a prescription, there are some important things, Reverend, that you have to note. And that is going to help you for the drug to work so that you get the full benefit of the drug. The first one that you have to bear in mind is so important is the dose. In other words, the amount and the quantity that has been directed by the physician or the pharmacist or the nurse. You deviate from the dose by taking an underdose or an overdose, you are in trouble. Overdose is going to give you side effects that sometimes it becomes so overwhelming that you need to withdraw the drug. And when you take an underdose, it's not going to work. So the dose has been carefully selected in such a way that you have full benefit of the drug. Apart from that, the time to take the drug is very important. The frequency and then the duration of action, the duration that you have to take the drug. Is it 1 week? Is it 2 weeks? Is it 5 days? That is also very important. And that will determine whether you are going to benefit from the drug or not. Sometimes, Reverend, we are giving medications, prescription medications, to take for 1 week. We take for 3 days. We are well, and therefore we leave it. And I dare say that for people who are busy, maybe your wife will look into your jacket and find that you have remnants of medication that you have been given, but you haven't finished taking because you were well. All right. And sometimes what happens is that because these drugs are available, maybe my symptoms are similar to your symptoms. So you tell me, oh, Kwesi, I'm not well. I said, oh, what's wrong with you? I describe it and say, that is the symptoms that I experience. So I'll give you some of the medication. We are abusing. It's not meant for you, all right? So we are abusing it. And I think these constitutes misuse, especially with prescription medicines. When it comes to abuse, abuse is entirely different. Remember that when it comes to prescription drugs, you are taking it for a specific ailment. When it comes to abuse, all right, you are taking the drug not for a specific ailment, but because you want to enjoy certain aspects of the drug. So you can get euphoria out of it, excitement out of the drug. And that is the main reason why you are taking the drug. It is abuse. You don't have to take it. There is an overlap. Of course, if you are taking antibiotics and you are not taking it according to the instructions given, you may describe this as an abuse. But let me give you the difference between misuse and abuse. In misuse, there is a definite intention to take it for a specific purpose. But when it comes to abuse, you want to take it for recreational purposes. You want to feel high, all right? You want to enjoy the euphoria. You want to enjoy the excitement. And that is mainly associated with hard drugs. So that's the difference.
Now, Prof, you seem to suggest that this impression that when we talk about drug abuse, we are talking about those tramadol, weed, you know, but you are saying that if you are supposed to take your prescribed medication 8 hours in between, and you do 12 hours, you are misusing the drug.
Yes.
If you are supposed to take 2 morning, 2 evening, and you do 2 and you don't do 2 evening, and you are misusing. Just look straight into this camera and talk to my viewers that it is not only those who are on tramadol and others who are abusing drugs, but those who are not working with the prescription, as you are telling me, equally are misusing drugs.
You are a very smart student. You understand, and I'm happy about that. Viewers, I just want to tell you that if you are taking a drug and you don't take it according to the instructions given to you by the physician or the pharmacist, then you are misusing the drug. And you are not going to get the full benefit of the medication that you are taking.
Now, viewers, this is what is next on GTV, the authentic and the trusted voice of Ghana. You mentioned some drugs, some antibiotics that even you are saying in UK, maybe they are going down in its usage. But what are some of the major medications commonly misused or abused in Ghana from where you stand as a professor of pharmacology?
The list is endless, Reverend. Let me emphasize that anytime you are given a prescription, whether it's for treatment of your hypertension or your diabetes, all right, and you are not taking it according to the instructions that you are given, you are misusing it, you are abusing it, all right, and you will never get a full benefit. So every medication can be abused. Let me put it that way. Every medication has the potential.
Not necessarily those on weed and tramadol, but even those that medical doctors, pharmacists are prescribing.
Yes, has the potential to be abused or to be misused. But for the sake of the viewers, let me mention some of the commonest drugs on our market that we abuse. I don't know, but we did a small research, undergraduate student, and I sent him to a hospital in the Ashanti region. And she was just looking at the prescription patterns from that hospital. Reverend, the result was interesting. About 90% of the prescription contained paracetamol. So on every sheet of prescription, in 90% of cases, it contained paracetamol. But people don't know that paracetamol is a very dangerous drug if you take in overdose. Let me emphasize. Now, if you take paracetamol in overdose, it is very dangerous because it has the propensity to affect the liver. And you know the importance of the liver in the body, you know, getting rid of all the toxic substances. So anytime your liver is affected, you are in trouble.
But it helps us to relieve pain as well, or?
Yes. So you have to keep, even as you want to relieve your pain, you have to keep within the dose that is given you. Sometimes paracetamol is written on a prescription and they say PRN. PRN means that as and when necessary, you take it. So if you give me paracetamol as a patient or as your client, I won't take it like 2 morning, 2 afternoon, and 2 evening, or 2 at night. I will not do that. If I'm not in pain, there is no point, because it doesn't do anything apart from relieving you of your pain. Is that okay? So you have to be careful. There is no pain. There is no need for paracetamol, knowing that it can be dangerous when you take an overdose. Painkillers are abused. The ones we call non-steroidal anti-inflammatory drugs. Ibuprofen, you know ibuprofen, a smart student, you know ibuprofen. You know diclofenac. These are used also to control joint pains, inflammation, etc. But you have also to know that when you take them in excess, you are likely to develop peptic ulcer.
What is it?
Peptic ulcer.
Yes.
Oh, the ulcer, ordinary ulcer,
oh, okay.
Where there is how do you call ulceration, or let me put it for the benefit of my viewers, wound. All right, in the GIT, in the gastrointestinal tract, in your stomach. Misuse, you're going to get that. Reverend, there are other drugs that are used a lot also. We call them Hypno Sedatives. And examples are diazepam, the one that they call volume, the blue tablets. They are very useful when somebody is anxious about something. He can't sleep, sleeplessness. He's bereaved and that kind of. He goes to see the doctor, may write it for the patient within a prescribed dose. But people abuse it a lot. When you take it, you are drowsy and you have to sleep. The young men who take it, all right, they will not sleep, and then they walk about in town, enjoying the, how do you call, drowsiness and misbehaving as a result of that. Reverend, that drug is abused a lot.
And it's not only those who are on the street, but the students who also want to stay awake. All the students are okay.
When you can't take Valium or diazepam and be studying, you can't do that because you're drowsy and you can't read. Okay, so if it's given to you by the doctor, you have to sleep.
Okay.
All right, but they will not sleep. Okay, they are enjoying the euphoria, they are enjoying the drowsiness, and then he'll be intoxicating, that kind of thing. They enjoy it, and it's abused a lot. It's abused a lot. Cough mixtures, maybe to your surprise, but cough mixtures are also abused because of what they contain. Some of them contain codeine, and codeine is a cough suppressant. If you are coughing, especially a dry cough, it will suppress the cough, and you are able to sleep at night. So some of them contain codeine. Some of them also contain antihistamines. Antihistamines are drugs that we use for allergic purposes, because if the source of the cough is allergy, it may also help. So some of these cough mixtures contain these things. Young men will look for this, all right, dose themselves with excessive doses of these antihistamines, and then becomes a problem. And the tendency is that even as you take it, there is a possibility that you become hooked. Let me put it that way. You become an addict to it. And if you don't get it, then you want to crave for it. And that is a problem.
What are the factors that will influence? Why would somebody say say hypertension and will not take his or her medication per their prescription? Why will people do that? Why will people do the things you are describing to me? Antibiotics. What would...
It's ignorance and lack of education. It's giving the prescription, and let me add also that some of them are stubborn. It takes the antihypertensive, tomorrow the pressure is down, all right? And he thinks that he measures the pressure, he thinks that is fine, okay? So he breaks. If you skip a dose, you are abusing the drug. And that is very important. Remember, I've mentioned some of the prescription drugs. Let me also mention some of the drugs, some of the hard drugs that people take. Cigarette is abused a lot. But thank God, the church has done well in this regard. I was just reading this morning, and I saw that 71% of the population are Christians. I don't expect a Christian to smoke. Maybe one or two, but they won't come close to the pastor. So in that sense, the church has done very well. People don't smoke much compared to developed countries, and I think that is a good thing. But alcohol is a problem. Alcohol is abused a lot, and alcohol can destroy your liver completely. It can cause cirrhosis, which is a harbinger. In other words, the first step to cancer. And people abuse alcohol a lot. Apart from that, there are drugs that we call narcotics. Narcotics like morphine, petidine, which are used to control tramadol, which are used to control moderate to severe pain. If somebody has a trauma, all right, the pain can be so severe, and then he's given some of these drugs. The pain will be relieved, all right. You will feel excited, less pain, and that kind of thing. So it's good for that patient. But mind you, you can easily be hooked onto it. We have seen cases where even staff, hospital staff, have been hooked to petidine, and that can be a serious problem. And people will go for this, all right, just to enjoy the euphoria, the excitement around it, and then become addicted to it. It's a problem, right? Then let me conclude here. Cocaine and heroin is also a serious problem. I don't know why people should go for that. What they don't know is that you can be trapped into using cocaine and then heroin. There is a tendency to be addicted to it. So you start using it, well, you are abusing it. Then you become dependent on it, and eventually you are an addict. You can't stop on your own. Because what you call withdrawal symptoms that you get when you don't get the drug, you are in trouble. For instance, if you are taking cocaine or heroin, and for a moment you need it and you don't get it, your heart rate will go up, your blood pressure will go up, you feel very uncomfortable, cramps in your tummy, all right? You are agitated, all right? You are angry with people, and all that you want to do is that whatever it takes to get money to be able to buy the drug, you go for it.
So, Prof, you see, the cocaine and that side is a whole story for another day. Yeah. But you mentioned cough mixture and what it takes. I have a dear sister who has never taken cough mixture with spoon before. Anytime she want to take cough mixture, she just open it, the bottle, and straight to the mouth. Take as much as. Yes. And you are saying that the cough mixture contains something. You are a professor of pharmacology. You have served on the FDA, Food and Drugs Authority. You've been on the Pharmaceutical Council. Yeah. You people are doing all manner of research. What I've been hearing on television is this drug, this food had been tested and approved by FDA without telling us that this cough mixture contains X, Y, Z that has been approved by FDA. That if you take it like my dear sister, not only that is being approved by FDA, blah, blah, and so, but you are doing something that FDA has not approved. What's the relationship between your research findings and public education on basic things like paracetamol, cough mixture, things that FDA might have approved, but the way we are using them have not been approved? Who is doing that education?
I dare say that we are not getting enough education as we should. I do expect that the program that we are having now will be held as often as possible, not only at GBC, but at other television stations as well, on radio as well. And then people will begin to appreciate the consequences of not taking the drug according to the prescription. And that will help us a lot. But that education is not coming out yet. Sometimes students will go on campaign trying to educate, the population on some of these dangers. Sometimes annual pharmaceutical society conferences, doctors' conferences, we talk about some of these things. But I doubt if the people who are supposed to get the message are able to get the message. And mind you, we are very stubborn people. So apart from the ignorance, stubbornness is also an issue that you have to deal with. But I want to reiterate that let us be careful of drugs. And let me quote Paracelsus. Paracelsus was a German toxicologist, and what he said was that we should all know that all drugs are poisons. And he emphasizes that
all drugs,
that's what he said, a philosopher. He said that all drugs are poison. There is none which is not a poison. It is the dose that differentiate a poison from a remedy. You understand that? So he considers all substances, including this water, as a poison. But if you take the right dose, then you are fine. And that is why the dose, frequency of administration, and all that are very important to get full benefits from the drug. So you must all note that drugs are dangerous, though they are very beneficial to us.
Interesting. But again, Prof, is there any relationship between increased use of antibiotics, as you mentioned earlier on, during pregnancy and childhood obesity and diabetes in later life?
Interesting. Before I attempt your question, let me use these platforms to say that drugs and medications might be avoided during pregnancy unless it is absolutely necessary and is prescribed.
Please say it again.
I just want to tell the public that, remind viewers that drugs should be avoided, medications should be avoided unless it is absolutely necessary in pregnancy, and it must be prescribed by a qualified medical doctor.
Sometimes the ladies are vomiting, they are in pain, and you are saying that if paracetamol can help, they shouldn't. Is that what you are saying?
This one, you didn't hear me right. I said, okay, unless it is prescribed.
No. I have some in the box in the house.
No, you can't take that.
Okay.
You can't take that. It is, you see, most of the medications that we have, we look on the bottle and most of them is written, the effect on pregnancy is not, it has not been tested in pregnant women. The reason is simple. Because you can't do clinical trials of pregnant women. So most of the drugs that we take, we don't know their effect on the embryo, we don't know their effect on the fetus. And that is why you must avoid it unless it is absolutely necessary and unless it's prescribed. Especially during the first trimester, I'm talking about the first 3 months, where the embryo is dividing rapidly. Even antibiotics can affect the growth of the embryo.
The first 3 months of pregnancy
is quite dangerous, and we have to be careful. This one, I would wish that we take it seriously. We don't know what's going to happen. It's tested in animals, all right, but the effect that you get in animals is not always replicated in humans. So maybe it may be safe in animals, but not necessarily in humans. And that is why I'm saying that you should be careful. Talking about antibiotics and in their relation to obesity, Reverend, there is a report that children who have been delivered by cesarean section grow big, all right, by their 7th birthday or so, compared to the cohort that is delivered by natural delivery. If you take that point, I'll be very happy, because I'm going to develop that. The fact that children who are delivered by cesarean section, all right, grow bigger. And it is interesting, because when you go to the villages, most of the births are natural births, and we don't normally see people who are obese. You don't see that in the village, all right? The reason is simple. When you deliver through the normal birth canal, all right, the mother imparts microbes, all right, that are essential for the child to develop his or her immunity, as well as metabolism is passed on from the mother to the child. If you use antibiotics, especially the trimester, first trimester, third trimester, when you are getting to delivery, you destroy most, because normally you use broad spectrum antibiotics. Broad spectrum antibiotics, I mean those that are able to kill gram-negative and positive, all sorts of microorganisms. So the quality of the microbes that the mother delivers to the child is reduced considerably. And in that case, then, you can't stand, how do we call it, immunity. Your immunity is reduced. And some of these microbes are also involved in metabolism of substances, all right, in the body, especially carbohydrates, proteins, all right, carbohydrates especially that are related to diabetes. Even as we sit here, all right, we are harboring a lot of microbes. Reverend, are you surprised to hear that? We are harboring microbes, all right? But 90% of them are useful microbes that the child needs, all right, to be transferred from the mother so that his or her immunity can be developed. We did a little work, all right, and from a hospital again in the Ashanti region. And it was a retrospective. And then we found that for the mothers who delivered in the hospital, about 65% of them obtained antibiotics during pregnancy. We did not see a relationship between the size of the babies, all right, and then the antibiotics. But we realized that those that received antibiotics, the children that were born, all right, had more unscheduled visits to the hospital. In other words, their immune system was very low. All right? And there is a study in New Zealand that has confirmed that if you give antibiotics to children, if you give antibiotics in pregnancy, by the 7th birthday you find that the baby is bigger than, normal. So that is the link. You don't get enough microbes to be able to fight the body's defense mechanism, to be able to help in the metabolism of carbohydrates. That's the link between antibiotics and diabetes. I'm sure you are a smart student, you understand what I'm saying.
Yeah, but Prof,
yeah.
I know attention KNUST, attention is given to traditional medicine in academic institutions in the recent years, but can there also be abuse or misuse in traditional medicine medications?
That is worse. That is worse.
Maybe for another full session, but just help my viewers to know how the traditional medication, even though now under university, you mentioned the Mampon one that you are served on the abort, how we are extending the medication.
Let me start from why the universities decided to do degree programs in herbal medicine. There is evidence that herbal medicines work. All right, but one thing that I would like to caution my viewers is that if there's an acute situation of hypertension, if there's an acute situation of diabetes, and you joke with herbal medicine, you will die because they work a bit slowly. So they are very good for maintenance doses, maintenance of the disease, all right, controlling the hypertension rather than when there is an acute case. Let's leave acute cases to the doctors to manage, all right? It must be referred so that the pressure can be brought down, and then much later, when the pressure is settled, then you can maintain with herbal medicine. We have plants in the country, very resourceful plants that can be used in herbal medicine and for treatment of diseases. But we thought that the practice of herbal medicine is not right. Charlatans all over the place, and somebody can just put something in a bottle, label it, and give it to you. All right. So the idea was that we should then step up the training and practice of herbal medicine to a level, all right, that will benefit our people, and that is why we established how do we call it, BSc in herbal medicine at Kwabena University of Science and Technology. And the face of herbal medicine is gradually changing. Previously, you visit a practitioner, all right, he will just look up the do some magical religious things, and he says that we don't want it that way. It is science. It is science. And it must be evidence-based. That is what we are trying to achieve. Herbal medicines can be abused, right? Sometimes you take a product, my colleagues in chemistry, they do it all the time. That is one product, that's one product from the same batch. Then you find that the composition of this one is different from that one. How can that be? So from the onset, we don't have the right concentration there. How is it going to work for the patient? All right? And the abuse and the misuse of herbal medications all over the place. All over the place. And I think that there will be time in future for us to go into the details of this.
Viewers, this is What is Next? And I'm in conversation with Reverend Professor Charles Ansah. And we are reflecting on misuse and abuse of medication. Prof, some people are afraid of vaccinations due to the side effects. However, serious and fatal diseases can result from not having a vaccination. In epidemic, pandemic, those who have not been vaccinated will be most at risk. How do we handle this balance of, I'm afraid vaccination will do this, and the fact that if you are not vaccinated, the risk is higher?
It's the lesser of two evils. The pandemic is here with us, and if you don't have the immunity to it and you get it too bad, you may lose your life. But let me say that every foreign substance that is introduced into the body will react in a certain way. And we call something biological variation, where your reaction to that foreign substance and mine may be different. I took the first jab of the vaccine, and in the evening I felt some slight headache. Gertrude took it, and she was walking around.
Gertrude, you mean your wife?
Yes.
Okay.
Nothing has happened, So people react different and respond differently to foreign substances. But that should not. Of course, some were hospitalized because of that. A few were hospitalized because of that. But that shouldn't deter anybody from taking a vaccine if you have the opportunity, because that is your protection yet, in case you get a disease. That's all I want to say now.
You are a professor of pharmacology. I believe you've been watching what is happening in India. Now, how do you explain it? And if you have opportunity to talk to Ghanaians and colleagues, medical people, pharmacists, government, those of you managing health front, what will be your caution?
The first thing is that anytime you get the opportunity to take the vaccine, do it. And I pray, and I want to encourage government to try and get us more vaccines. That's the first one. But meanwhile, the protocols must be observed. The distance between the two of us, very important. We wear our mask, we wash our hands, and all that. And unnecessary gatherings must be reduced considerably, because that's where you get the infection. And I think that if you're able to do that, you have been blessed, because you haven't had many cases. Indeed, the other time you heard that we were given a license by the FDA to be able to do clinical trials on a plant material that we are working with. All right? I'm a member of the team. Even now, you can't get patients, and we thank God for that. You can't. You would have wished that we had patients to be able to try it, but we are not getting. We thank God for that. All right. So we have been so blessed, so blessed. Let's maintain it, washing our hands. All right, wearing our masks and all that. And I think that you'll be able to continue. The India case is terrible. Now even getting the opportunity to burn your dead is a problem. And I think that is worrying. We should by all means try and avoid that here.
I want you to look straight into this camera and talk to our national leaders. India is helping us with the vaccine. But if our leaders still the protocol, how do we relate with India now? What would be your advice? If you have to, you're a medical person, you are researching into this. You say the team that is working on plant thing. India is helping us. But if we have to relate with people visiting, going to India and all that? What would be your advice? As a medical person, as a pharmacist, yeah.
Alaji Kwaku will always say that, look, I'm not a lawyer. Let me declare that I'm not a medical doctor.
You're not a medical doctor.
Yes, I'm not a medical doctor.
You are producing the pharmacists in Ghana, yes.
But the thing is that if I were in charge, I would recommend that certain countries where there's a third wave, all right, you should stop them from entering our country. That one would be my strongest recommendation yet. Because the variant in India is very virulent. And if you are not careful and we get that here, we are in trouble. That's what we want to avoid. And it is also in their interest as well. It's the interest not only of other countries, but globally to be of interest. Because what we want to do is to reduce the infections. Ghana, you cannot contain what is happening in India. I pray that it doesn't happen here.
Viewers, this is What is Next on GTV, the authentic and the trusted voice of the nation. Prof, you are not only university administrator, you are not only a pharmacist, a professor of pharmacology, but you're also a man of God. Yeah. At what point can a pastor, a malam, traditional healer instruct a patient on admission in a health facility to stop taking his or prescribed medication in the name of divine or spiritual healing?
Under no circumstance, Reverend. Under no circumstance. Under no circumstance. Let me say, under no circumstance. Look, I'm a man of God. I believe in spiritual healing and divine intervention. But God created us in his own image and has given us the wisdom so that we learn science and help ourselves with that. The medical doctors are well trained. They're able to diagnose, they're able to prescribe appropriate medication, all right, for the patient. So if he's in hospital, what business have you to say that I'll take him from the hospital, I don't want him to be in the hospital? You have no authority. Allow them to do what they can. Working of medications and success in treatment is just like prayer. Reverend, when you are praying about something, sometimes you stand to pray. Instantly, you receive the answer. Sometimes it delays. Sometimes it doesn't come at all. God says that, my child, I won't give you this. In the same way, if you are given a medication and it's not working immediately, it does not mean that it's not going to work. And that is why doctors will come for review from time to time. Okay? When you go and they think that they need to change the medication, they will change. Healing will delay, but it will surely come. Sometimes it comes instantly, sometimes it takes time. Under no circumstance. So, Reverend, my worry is that...
What would be your advice for colleague pastors who send anointing oil, water they have blessed to patients on hospital beds and tell them that they shouldn't take the prescriptions that they've been given, and people are doing that on a hospital?
It is wrong.
So what would be your advice?
I'm not a lawyer, but I don't know what I can say. It is criminal, but you don't have to do that. You see, some of the concoctions that we send to patients in the hospital, all right, we don't know what is in there. Yet, they smuggle them to the patient. And even as the patient is taking the medication prescribed by the doctor, sometimes you find that they are taking those medications as well. There can be interaction. So the doctor comes, I've prescribed something special for this patient that I think is sure it's not working. And the patient will never tell the doctor that I'm taking something else. Why should you do that? So I want to tell my colleague pastors, by all means, let us pray for them, all right? Divine intervention. But let us also allow the doctors to treat our patients for us.
Prof, your last word for my viewers.
I think that what I want to tell them is that medication helps us, is of benefit. But incorrect use of medication, irrational use of medication must be avoided. And for that reason, you should try as often as possible to abide by the instructions of the doctor. Drug abuse leading to social vices, all right, is a problem for this country. Can we all team up together? NGOs, all right, government, churches, can we team together to ensure that we bring it under control? And this will come through education. Let us all work together to ensure that we protect our people from drug abuse and misuse. Thank you very much.
Viewers, this is what is next. Now I've been in conversation with Reverend Professor Charles Ansah. We've been reflecting on the subject, misuse and abuse of medication. And our focus is not just on those who are on tramadol and but we are talking about people who have proper prescription from doctors, from their pharmacists, nurses, but you can still misuse your prescription. And that is the education he is giving to us. We will come your way same time next week, God willing. But till then, may the good Lord bless our homeland Ghana and make this country great and strong. Prof, we are so grateful for the time. My name is
Thank you for
Kwabena
having me.
Opuni-Frimpong. Thanks for watching.